Hello all, my name is Sadanke Kaba and my case study is on infant mortality in Louisiana. My audience is the Louisiana Bureau of Health Director and my position is a health educator. What is infant mortality? According to the Centers for Disease Control and Prevention, infant mortality is defined as the death of the baby before his or her first birthday. The infant mortality rate is the number of infant deaths that occur for every 1,000 live births. This rate is used as an indicator to measure the health and well-being of a community. Factors that affect the health of the entire population can also impact the health of the infants. Examples could be environment, race, gender, and socioeconomic status. Some statistics for Louisiana are Louisiana has the second highest infant mortality rate in the United States of America, with 8.9 of every 1,000% of all babies dying before their first birthday. Louisiana was one out of three states that received an F grade from March of Dimes due to their high incidence of babies being born before 37 weeks gestation. Problem that Louisiana newborns are facing is that they have a high risk for premature birth, which can lead to infant mortality. About 15% of babies are born before term. Preterm deliveries put newborns at risk for complications with vision, hearing, heart rate, blood health, immune systems, and breathing. Could you imagine just starting life and having to face these challenges and obstacles? Who is impacted? Newborns are. Newborns are more likely to die if their parents are in a low socioeconomic status compared to a newborn that parents are in a high socioeconomic status. This is very unfortunate. A child's life expectancy should not depend on the amount of money that their parents have. About 28% of childbearing women are not insured at all in Louisiana. Women in low socioeconomic communities have limited access to health care and may not receive proper or any prenatal care while being pregnant. Some examples are the women may not have money to pay for transportation to attend their appointments every month, or they may not be able to take off work to go and see the doctor. There is a correlation between poverty and negative birth outcomes. Some of the women practices that women in Louisiana do can negatively affect their infants. 25% of women in Louisiana between the ages of 18 to 44 are smokers. One in five babies born to a mother that smokes during pregnancy has a low birth weight. Tobacco smoke can harm babies before and after they are born. A mother that smokes during pregnancy is more likely to deliver their baby early. Another health practice is that women in Louisiana like to induce C-sections. In 2011, Louisiana led the nation in the number of babies delivered by C-section with 40%. There is a practice of inducing labor before 39 weeks gestation, even if it's not medically necessary. Scheduling C-sections early and inducing labor are contributors to infant mortality. Remember, a mother's lifestyle choice can cause negative impacts to the newborn. So here is the social economic model on the individual level. Knowledge can benefit the health of the infant. A mother that is aware of her health and seeks medical attention before and during pregnancy is less likely to experience health issues during pregnancy. As well, being educated on health behaviors that are safe and healthy for her and her child will increase the chances of a safe baby that will live. For a mother that has some knowledge, she'll be able to know like, oh, I need to eat this while I'm pregnant, I need to do this while I'm pregnant, or I need to go and see my doctor every week. They'll know the things that they need to do in order to ensure that they have a healthy child. Race can hinder the health of infants. Unfortunately, in 2013, African American mothers had the highest rate of infant mortality in Louisiana. The rate was 11.11 per 1,000 live births compared to non-Hispanic white mothers whose rate was 6.96 per 1,000 live births. On the interpersonal level, medical providers can perform screenings of smoking to their pregnant patients, which providers would be able to receive incentive for doing the screening on Medicaid patients. The percentage of women who smoke between the ages of 18 to 44 is 22.9% in Louisiana and 19.6% overall in the United States. Something that could negatively affect the child is the relationship between the mother and the biological the father. Women who are victims of domestic violence have a higher risk of low birth weight, premature birth, and infant mortality compared to women who do not experience domestic violence. On the organizational level, the Department of Health can work with Louisiana March of Dimes and hospitals to start the Full 40 initiative in the state. This is a voluntary pledge that hospitals sign up to end non-medically indicated induced pregnancies. Access to healthcare is a factor that can hinder a baby's life expectancy. About 28% of childbearing women in Louisiana do not have insurance. Having access to healthcare is very important while being pregnant. The mother receives the appropriate testing and checkups that are necessary. On the community level, providers in the community that are trying to provide ways to decrease the infant mortality, if they try to create initiatives to decrease the issue by working with doctors and hospitals on decreasing C-sections, that will definitely decrease infant mortality. The location where a baby is born can determine their life expectancy. In the city of New Orleans, neighborhoods can predict if the baby will live until the age of 80 or 55 years old, depending on the rate of smoking, excessive drinking, obesity, poverty, and violent crimes. On the policy level, a public policy that benefits infants in Louisiana is the state's legacy Medicaid and Bayou's health plan, which does not reimburse providers for early elective deliveries that are before 39 weeks. Title V and Health Start are regularly at risk in budget discussions. These are both government funded to assist with lower infant mortality, improving health and development of American children. Some proposed interventions are the Best Fed Beginnings Program. This is partnering with CDC and Baby Friendly USA, the United States Breastfeeding Committee, and this is to increase the number of breastfed babies. Hospitals would complete the American Academy of Pediatric endorsed 10 steps to a successful breastfeeding program. Once the hospital has completed the program, they would receive a baby-friendly designation from the World Health Organization and United Nations Children Fund. Louisiana could save $216 million annually and receive 18 deaths per year and reduce 18 deaths per year if 90% of newborns were breastfed exclusively in their first 6 months of life. So this program is focusing on increasing women who exclusively breastfeed their babies from the time that they're born until the 6 months checkup. Another intervention would be the Go Full 40 initiative. This would be a voluntary pledge from Louisiana hospitals to end non-medical indicated induced pregnancies, which would be collaborating with the Louisiana Department of Health, Louisiana March of Dimes. This would promote long-term systemic changes that are necessary to reduce C-sections, improve birth, and premature birth outcomes. Waiting until 40 weeks gestation to give birth reduces medical complications for both the mother and the child if the induction was not medically necessary. Birth Outcomes Initiative is with the Louisiana Health Department to launch a culture of continuous quality improvement and safety in birth hospitals, assess and improve the behavioral health of Louisiana pregnant women. Lastly, change DHH data capacity and performance measurement of maternity care and increase accountability for clinical outcomes. So this is a great program to just try to change the whole process of women in Louisiana who are giving birth. Behavioral health is something that's very important, and we are starting to find out that it can cause many other issues. If a mother, if her mental state is not in the right state of mind, then her child will definitely be affected. So working on with the mother to try to control her behavioral issues would help with the birth outcomes. Improving birth outcomes would advance health equity in the state. So as a health educator, my contribution to this health issue is very important because I'd be providing education to the women of Louisiana to decrease infant mortality. Some things that I could provide are health education workshops on the importance of breastfeeding, promotion of healthy lifestyles to women of childbearing age, assistance to women to identifying proper resources and program necessary to ensure safe delivery and happy baby, educating women on health safe practices before, during, and after pregnancy, insights on the community's values, belief, and health behaviors that can negatively impact a baby's health. As a health educator, I would really be having a lot of direct care with the women in the community and finding out what things that they do believe and what do they not like, and trying to help to encourage them to increase healthier lifestyle changes that can benefit them and their baby. Although someone is pregnant, that first year is so vulnerable for the child. So just trying to create a lifestyle that would benefit the child is very, very important, and education is very needed for that. Some proposed evaluations for these three initiatives are for the Best breastfed beginnings program is mothers completing a questionnaire that would be asking them if they're exclusively breastfeeding their infant at the time of birth and at the baby's 6-month doctor visit. After the whole initiative, then mothers would complete the same questionnaire at the same time period, and comparison of data would occur. For the Go Full 40 initiative, there would be a baseline data that would be gathered from the hospitals that are involved in the program to see the number of non-medical induced C-sections that they perform in a 12-week period. After the intervention, data will be collected on non-medical induced C-sections in a 12-month period, and data will be compared to see if there has been a decrease. For the Birth Outcome Initiative, pregnant women in the state would complete a survey asking questions about their behavioral health, how they cope with their issues, and if they have access to resources. The data collected from the surveys would identify the percentage of women who are pregnant in Louisiana that have behavioral issues. After intervention, pregnant women would fill out the same survey as well to see if there has been a decrease in the percentage of pregnant women in Louisiana that have behavioral health issues. So what does success look like? Having 90% of newborns being breastfed exclusively in the first 6 months of life in Louisiana, all hospitals in Louisiana not conducting any non-medical indicated induced pregnancies, and pregnant women in Louisiana who have behavioral health issues will be receiving proper care and support. So some challenges and barriers with this, trying to decrease this infant mortality issue with the interventions would be hospitals could lie about participating in the initiative. They could say, oh yes, we are doing it, but still doing these C-sections because they can get financial gain from it. Patients not filling out the questionnaires correctly. A lot of times people may not want to share their true beliefs or what they're really thinking, and uncontrolled factors for reason why mothers stop breastfeeding before 6 months. Some women might not be able to produce enough milk for their child, so they may have to actually stop breastfeeding even though they may actually want to, or they may have to go back to work and are working long hours so they're not around with their child and their milk dries up because they can't pump while they're at work. So for the logic model, inputs are health education from health educator, OBGYN specialty from medical providers, program initiatives from Louisiana Department of Health, Louisiana March of Dimes, lactation education, behavioral health expertise. Activities that would be partner with organizations that work with underserved populations in Louisiana. Health educator provides best breastfeeding education workshop, promote breastfeeding to mothers. Health educator promotes healthy lifestyles to women of childbearing age. Hospitals and medical providers engage in the Go Full 40 initiative, launch birth outcomes initiative in Louisiana. Hospitals participate in Best Fed Beginnings program. Our participation would be childbearing women in Louisiana, first-time mothers, infants, and babies in Louisiana. Outcomes would be to increase in percentage of newborns being exclusively breastfed in their first 6 months of life, elimination of hospitals conducting non-medical indicated induced pregnancies, reduction in C-section rate in Louisiana hospitals, decrease in the percentage of pregnant women who have behavioral health issues in the state, mothers making healthy lifestyle choices, mothers receiving proper prenatal care, mothers being educated on the importance of breastfeeding and how to do it correctly and effectively. Louisiana hospitals are agreeing to engage in positive birthing outcome initiatives. Pregnant women are being screened on behavioral health at their first prenatal appointment. Decreased infant mortality rate in Louisiana. The impact is decreased infant mortality. So these are the bibliographies, and thank you. Let's decrease infant mortality in Louisiana.